Hello. Today we will study about some muscles seen in the scapular region. These are the major muscles and which has a very important role in moving the shoulder joint as well as the shoulder girdle itself. These muscles are trapezius, latissimus dorsi, supraspinatus, infraspinatus, teres minor, subscapularis, teres major, rhomboides minor and levator scapulae. The trapezius and latissimus dorsi are flat muscles which are having a very wide origin, and the fibers of these two muscles convey to a very small area. Supraspinatus, infraspinatus, teres minor and subscapularis, these four muscles together have a very important role in the shoulder joint, and these four muscles together is named as the rotator cuff. The rhomboides major and rhomboides minor are two muscles by which the scapula is attached to the axial skeleton, to the vertebral column. The levator scapula is one unique muscle, is attached to the scapula, and the name itself says what is the function of it. We will see these muscles one by one. About the latissimus dorsi. The latissimus dorsi is a very flat muscle and has a very broad origin from the lower part of the thoracic and lumbar region. The fibers are arising from T7 to T12 vertebrae and indirectly from all the lumbar vertebrae, but here in the lumbar region the fibers are not directly arising. Instead, this is arising from a deep fascia named as a thoracolumbar fascia. Few fibers are also arising from the iliac crest. The upper fibers are almost horizontal, the lower fibers are almost vertical. They ascend and they converge. You can see the origin of latissimus dorsi from T7 to T12 spines, and from the lumbar region indirectly from the thoracolumbar fascia. Few fibers directly arises from the iliac crest, and all the fibers converge laterally and upwards. On reaching the posterior wall of the axilla, there is a muscle named as the teres major. The fibers of the latissimus dorsi overlap the teres major muscle, and the fibers wind around. They go in a spiral manner below the lower border of the teres major. You can see that spiral pattern, so that the fibers twist and they go spirally, and it is inserted to the floor of the bicipital groove. So both together forms the posterior axillary fold. So here is the origin. T7 to T12 spines, thoracolumbar fascia. From the outer slope of the posterior 1/3 of the iliac crest. The fibers are having a twisted insertion. That means the upper fibers are inserted to the lower part of the groove, and the lower fibers are inserted to the upper part of the bicipital groove. So the entire muscle is inserted to the floor of the bicipital groove. Nerve supply to this muscle is a nerve to latissimus dorsi, which is arising from the posterior cord of the brachial plexus. When you consider the action of the latissimus dorsi, it is a powerful extensor muscle of the shoulder joint, especially when the shoulder joint is flexed. This is the movement. This movement shows the flexion of the shoulder joint, and the latissimus dorsi pulls in that direction from behind, so it moves backwards. This is one most important muscle which helps in a climbing action, like an individual climbing a tree, when it grab the tree and push back. So this movement is produced by the latissimus dorsi. It is also a medial rotator of the humerus. That means it helps to rotate the humerus medially, like this. This is medial rotation of humerus, and opposite is lateral rotation. So it is a flexion, it is an extensor muscle as well as it is a medial rotator. That is the action of latissimus dorsi. Here are the bony landmarks. This is external occipital protuberance, superior nuchal line. These are the transverse processes of C1, C2, C3 and C4. That is the spine of the first cervical vertebra. This is spine of C7. Here will be T1, spine of T1 vertebra, and here is the spine of the T5 vertebra. The root of the spine corresponds to T3 vertebra. The inferior angle of scapula normally corresponding to the spine of the T7 vertebra. Here I am going to tell three muscles. The first muscle is the levator scapula, which is arising from the transverse processes of C1, C2, C3 and C4. All together, this runs downwards and laterally, and it is inserted to the medial border of the scapula above the spine. When the muscle contracts, it helps to elevate the scapula. Hence, it is named as the levator scapulae. A small quadrangular muscle arising from C7 and T1 spines runs downwards and laterally and is inserted to the region of the medial border close to the root of spine. This muscle is named as rhomboides minor. And another flat rhomboid shaped muscle arising from second thoracic vertebral spine to the fifth thoracic vertebral spine. And this muscle is named as rhomboides major. And it is having a strip-like insertion on the dorsal surface of the scapula close to the medial border. These two muscles, rhomboides minor and rhomboides major, helps for retraction of the scapula. Means it moves the scapula more medially. So these two are the muscles which connect the scapula to the axial skeleton. There is a small muscle to the upper border of the scapula, close to a notch on the upper part of the scapula named as the suprascapular notch. Here is a suprascapular. So medial to the suprascapular notch inserts a small muscle which comes from the region of neck named as the omohyoid. Here runs the spinal accessory nerve superficial to the levator scapula and the rhomboides muscle. It supplies the trapezius muscle. And the superficial branch of the transverse cervical artery is accompanying spinal accessory nerve. Deep to this levator scapula and rhomboides major and minor runs the dorsal scapular nerve. The dorsal scapular nerve is the nerve supplying these muscles. The dorsal scapular nerve is accompanied by the deep branch of the transverse cervical artery.